What if you could restore your body's intrinsic sensitivity and inner vitality with just 60 seconds of gentle massage, utilizing only your own hands? I am referring to the experience of feeling that subtle wave of warmth and responsiveness that may have been absent for years without the necessity of hormone therapy, pharmaceutical treatments, or uncomfortable clinical visits. This is your body re-engaging its natural functional capacity. I kindly urge you to remain attentive for the next few minutes. In this discussion, I will disclose a specific, potent location on the body, unfamiliar to most women, and demonstrate the precise massage technique required to reawaken the deep feminine sensitivity you may have considered lost. What you are about to learn is a valuable resource for maintaining vitality throughout your later years. I am Dr. Lily Stones, a gynecologist and specialist in intimate health psychology with over 30 years of clinical experience guiding women to restore sensitivity, confidence, and pleasure. Today, I want you to envision waking up tomorrow with a natural warmth and responsiveness you believed had permanently diminished. No hormones, no expensive treatments, no inconvenient appointments. Just one gentle massage technique that operates in harmony with your body's intrinsic rhythm. By the conclusion of this discussion, you will know the exact location of this powerful site, the correct method of manipulation, and the optimal frequency of practice to initiate measurable, sustained improvements in your sensitivity and intimate vitality. And for those seeking committed change, I will reveal my 30-day challenge at the end. But first, you must comprehend the scientific rationale for this technique. Once you understand the mechanism, you will recognize that you are not merely touching the skin. You are activating a critical circulatory pathway and providing your body with the natural flow and vitality it has been implicitly requesting. The science of pelvic flow restoration let us conceptualize your body as an intricately designed system. For your intimate response to feel natural and active, 3 primary components must communicate optimally. The brain must transmit signals of desire. Vascular perfusion, blood flow, must be free and robust. Pelvic musculature must respond with strength and appropriate rhythm. Post-menopause and with advancing age, these pathways often decelerate. The neuro-somatic communication loses clarity, akin to static interference on an old transmission line. Blood vessels exhibit reduced flexibility, leading to vasoconstriction instead of expansion. The pelvic muscles, which are integral to sensation and pleasure, may lose tone and exhibit delayed response. This is why natural sensitivity frequently begins to fade after 50 or 60. It is not that your body is damaged, it simply requires a gentle reminder of its functional capacity. The technique I am about to share is derived from centuries of traditional healing practices, now supported by modern anatomical and neurological science. When you stimulate certain pressure points in the pelvic region, you transmit direct awakening signals through your nervous system, effectively jumpstarting a dormant circuit. You are bypassing the slower pathways of age and reigniting your body's innate flow of energy and arousal. These signals travel instantaneously to your spinal center, encouraging vascular opening, vasodilation, muscular relaxation, and increased nourishment to your intimate tissues. Furthermore, this specific location also contributes to the toning of the deep pelvic muscles that underpin sensitivity and response. Therefore, you are not only reawakening sensation, you are aiding your body in maintaining responsiveness, strength, and ongoing vitality. Locating the perineum. The control center, the potent location, lies within your perineal region, the delicate area situated between your vaginal opening and your back passage. Please process this anatomical information fully. The powerful point I am referring to is your perineum. It is the soft area of skin between the vaginal opening and the back passage. Some describe it as the intimate bridge. Medically, it is the perineum. Attention to the following detail is critical to understanding its efficacy in restoring feminine sensitivity and circulation. Directly beneath this delicate skin lies a rich network of nerves, blood vessels, and deep pelvic musculature that profoundly influence arousal, lubrication, and pleasure. When this spot is gently manipulated using the correct technique, you are safely and comfortably working from the exterior. The subsurface effect is restorative. You are enhancing blood flow to the entire pelvic region, activating nerve endings that may have become quiescent due to years of disuse, and inviting your body to respond again. This area functions as a hidden control center where the body's natural signals of warmth, desire, and sensitivity converge. Intentional, gentle stimulation can begin to restore the natural responsiveness you believed was permanently lost. The simple technique check and practice to locate your perineum. Sit comfortably in a chair or lie supine with your knees bent, ensuring a state of physical relaxation. Use your index and middle fingers together and gently place them on the soft area between your vaginal opening and your back passage. Apply light pressure. You will feel a subtle firmness beneath the skin, a small cushion of tissue. This is your perineum. The area beneath is rich in nerves and vessels that influence sensitivity. You will confirm the correct spot, as it may feel slightly tender or noticeably responsive to the touch. This tenderness is a positive indicator, signifying the area's readiness for activation and the beginning of circulatory return. Do not stop here. Initially, the area may feel unfamiliar or awkward. Most women have not been instructed to acknowledge this region. However, as you initiate reconnection, that initial awkwardness will be superseded by a growing sense of warmth, curiosity, and somatic comfort. Ensure you fully understand the location before proceeding. Detailed protocol for the 60-second massage. This practice is straightforward, but it must be performed with care and precision to maximize benefit and prevent discomfort. Achieve comfort. Sit in a comfortable chair or lie on your back with knees bent and feet flat. Relax your shoulders and slow your breath. Ensure you have privacy and will not be interrupted. Locate the spot. Using your index and middle fingers, gently find your perineum. Press lightly until you feel the subtle cushion beneath the skin. Apply gentle, steady pressure. This is crucial for awakening circulation. The pressure should be firm and consistent, but never painful. Think of it as activating a switch with precision, not force. Begin lightly and gradually deepen the pressure as the tissue warms and relaxes. Initiate circular motion. Execute gentle clockwise circles for 30 seconds, sensing warmth spreading through the pelvic area. Then, transition to counterclockwise circles for another 30 seconds, maintaining a calm, steady rhythm. Incorporate deep breathing. This is the most vital step for tension release. As you massage, take long, slow breaths. Inhale through the nose for 4 counts, hold for 2, and exhale softly through the mouth for 6. Feel your pelvic muscles release tension with each exhale, facilitating increased blood flow. That constitutes the complete technique. 60 seconds total, 30 seconds clockwise, 30 counterclockwise, performed with gentle, steady pressure and calm, complete respiration. It is a simple, restorative, and remarkably powerful practice. Timing and expected outcomes. Consistency is paramount to achieving results. I recommend practicing this gentle massage twice daily. Once in the morning, ideally while still relaxed in bed, to awaken the pelvic region and enhance circulation for the day, and once before bed to release accumulated daily tension and promote balanced overnight circulation. You may also perform this massage 15 to 20 minutes prior to anticipated intimacy. The immediate boost in blood flow often enhances the body's responsiveness, leading to sensations that feel deeper, fuller, and more natural. The key is to establish this as a small, dedicated habit. One session will not yield transformation, but consistent practice over 2 to 4 weeks can bring remarkable, noticeable improvements. Expected timeline. First few days, many women report a gentle warmth, a subtle tingling, or a renewed sense of connection in the pelvic area. First week, you may notice that arousal initiates more easily, natural lubrication begins to return, and the body feels more responsive to touch. Weeks 2-3, clear improvements are common. Warmth returns faster, moisture increases, and sensations that felt distant begin to reawaken. Touch feels more effortless. Week 40, many describe a complete renewal of sensitivity. Arousal flows more easily, pleasure deepens, and confidence subtly blossoms. Individual responses vary. If your reduced circulation or sensitivity has been long-standing, results may require longer. If the changes are more recent, improvement may be sooner. Consistency and patience are the most critical factors. Your body is listening even when changes are subtle. To deepen your results, integrate the following: use natural oils. Apply a small amount of pure coconut oil or unscented natural massage oil to your fingertips to reduce friction and enhance comfort. Combine with pelvic floor toning. Following the 60-second massage, perform 10 to 15 slow Kegel squeezes. Contract the muscles used to stop urination midstream, hold for 3 seconds, and then release fully. This strengthens the supporting musculature. Maintain hydration. Circulation is dependent on hydration. Aim for at least 8 glasses of water daily. Incorporate warmth. Practice the massage during a warm bath or shower. The heat naturally softens muscles and boosts pelvic circulation. Important safety notes and final challenge. Please review these safety instructions carefully. Avoid massage during acute symptoms. Never massage this area if you are experiencing pain, active infection, inflammation, or any open skin. Consult your physician before resuming. Consultation for pre-existing conditions. If you have been diagnosed with pelvic floor dysfunction, prolapse, or chronic pelvic pain, consult your healthcare provider first. This practice is typically supportive, but confirmation of suitability for your specific condition is essential. Adhere to dosage, do not overdo it. Twice daily for 60 seconds is sufficient. Excessive pressure or frequency can irritate sensitive tissue, which is counterproductive. Complementary care. This technique supports wellness. It does not replace medical treatment for ongoing conditions like diabetes, poor circulation, or hormonal imbalance. For optimal results, combine this daily massage with holistic practices that support circulation and vitality, movement, hydration, and mindful breathing. Add simple movement to your day. A short walk, light stretching. Remember that stress is a significant blocker of sensitivity. Incorporate moments of deep breathing to signal safety and relaxation to your body.